Melioidosis. You might not have heard of it, but it's a serious health threat in many parts of the world. It's caused by a bacteria called Burkholderia pseudomallei. This bacteria is not just any ordinary germ. This bacteria lives in soil and water, especially in tropical regions. Melioidosis is a disease that can be difficult to diagnose. This is because it can look like many other illnesses, like the flu or pneumonia. It's important to be aware of the risks and symptoms of melioidosis, especially if you live in or travel to areas where the bacteria are found. Symptoms can range from fever and cough to more severe conditions like abscesses and sepsis. Early diagnosis and treatment are crucial for melioidosis. If you think you might have been exposed to the bacteria, it's important to see a doctor right away. Remember, knowledge is power when it comes to protecting yourself and your loved ones from this hidden threat. Stay informed, stay safe, and spread awareness about melioidosis. You won't catch melioidosis from casual contact with another person. The bacteria usually enter the body through direct contact with contaminated soil or water. This can happen through open wounds, cuts, or even tiny breaks in the skin. Inhaling contaminated dust or water droplets is another way people can get infected. This is more likely during activities like gardening, farming, or construction work. Flooding can also stir up the bacteria, making it more likely to become airborne. While less common, it's possible to get melioidosis through contaminated food or water. This is more likely in areas with poor sanitation or where drinking water sources are not properly treated. While anyone can get melioidosis, some people are at higher risk. People with weakened immune systems are more susceptible to infection. This includes individuals with diabetes, kidney disease, or HIV/AIDS. Those who work closely with soil and water are also at increased risk. Farmers, construction workers, and those in the military deployed to endemic areas need to be particularly cautious. Living in or traveling to certain parts of the world also increases your risk. Melioidosis is most common in Southeast Asia and Northern Australia. It's important to be aware of the risks if you're planning a trip to these regions. Section 4. Recognizing the symptoms of melioidosis. Melioidosis can cause a wide range of symptoms, making it tricky to diagnose. The symptoms can vary greatly from person to person. Some people experience mild flu-like symptoms such as fever, muscle aches, and headaches. These symptoms can often be mistaken for other common illnesses. Others develop more severe symptoms like chest pain, cough, and difficulty breathing. These respiratory issues can sometimes be confused with pneumonia. Skin infections are also common with melioidosis. These infections can appear suddenly and may be painful. These can range from small sores and abscesses to larger, more serious infections. Severe skin infections can lead to significant discomfort and require medical treatment. If you notice any unusual skin lesions, especially after potential exposure to contaminated soil or water, seek medical attention. Early diagnosis and treatment are crucial. It's important to remember that melioidosis symptoms can appear anywhere from a few days to several weeks after exposure. The incubation period can vary widely. In some cases, the bacteria can remain dormant in the body for years before causing illness. This makes it even more challenging to identify and treat. Section 5. Protecting yourself and your loved ones. The good news is there are steps you can take to protect yourself and your loved ones from melioidosis. This bacterial infection, though serious, can be prevented with some simple yet effective measures. If you're in an area where the bacteria are common, wear protective clothing like boots and gloves when working with soil or water. This is especially important for those who work in agriculture or gardening. Cover any cuts or wounds with waterproof bandages to prevent contamination. Even small cuts can be entry points for the bacteria, so it's crucial to keep them protected. After being outdoors, wash your hands thoroughly with soap and water, especially before eating or touching your face. Good hygiene practices can go a long way in preventing infections. Be sure to drink safe, treated water and avoid swimming in stagnant water sources, especially after heavy rains. Contaminated water can be a breeding ground for harmful bacteria. By taking these simple precautions, you can significantly reduce your risk of contracting this potentially dangerous infection. It's all about being mindful and proactive. It's time to break the silence surrounding melioidosis. Awareness is the first step towards prevention. Spread awareness among your family and friends, especially those planning trips to at-risk regions. Knowledge can save lives. By working together and taking necessary precautions, we can protect ourselves and our communities from this hidden threat. Let's make safety a shared responsibility.